Yes, so I'm Anthony Hannan. I'm at the Florey Institute of Neuroscience and Mental Health in the University of Melbourne, and I'm representing the International Brain Initiative as co-chair. In my opinion, the real solution is research. And my focus, of course, is on neurological and psychiatric disorders, which collectively are the largest global burden of disease and the most rapidly growing burden of disease. The brain is the most complex entity in the known universe, and therefore there's enormous challenge in trying to prevent, to treat, to cure all of these brain disorders. And therefore, I think through what the International Brain Initiative and other neuroscientists and brain initiatives around the world are doing is that what we want to do is to deliver the most efficient way in which to prevent and treat brain disorders, which by doing that, I think we can contribute to that being a solution that provides equity, because it will be done in a way that is cost effective and in a way that can be rolled out globally. I think meaningful actions to patients, in my view, all need to be evidence-based. And I think our understanding is that a lot that's done currently within science and health and medical research on the one hand, but also in healthcare delivery, is neither efficient nor 100% evidence-based. So I think there's enormous potential, not only at the end where I'm most active, which is neuroscience and health and medical research, to make discoveries that can deliver new ways to prevent and treat brain disorders. That's part of it. But at the other translational end, as we go from preclinical to clinical, I think there's enormous scope to increase efficacy and efficiency. I think there's a lot of inefficiency, and I think a lot of it is because we don't have enough international collaboration. There's a lot of duplication, and sometimes replication is crucial, but there's a lot of unnecessary duplication because there's not enough international collaboration. In our case, we're interested in collaboration between neuroscientists, but this applies to all health and medical researchers. We need more international collaboration so that the international health and medical research community, whether it's brain disorders or cancer or cardiovascular disease or diabetes, whatever the challenge is, that we can be as efficient as possible, and international collaboration increases both efficacy and efficiency. I think international partnerships have enormous potential. In our case, from the perspective of the International Brain Initiative, where we're linking brain initiatives from all over the world, and we've brought in most recently Latin America and Africa to the brain initiatives that were already there from Europe, Asia and North America. And so we have a truly global network now of brain initiatives. And part of this is the original brain initiatives, the earliest ones that came from Europe, from North America and Asia, have enormous resource in generating new neuroscience data. And it's quite expensive, that kind of work. But we're not really making the most of that new data and those enormous amounts of data. And by bringing in the rest of the world and collaboration, developing countries have enormous human resource that has the capacity to help analyze and make the most of this data. And by working with countries that are already generating a lot of that data, to bring in countries that have enormous potential to optimally analyze that data and therefore contribute to the prevention and treatment of brain disorders, I think that international collaboration could greatly accelerate the process of discovery, but also the process of going from preclinical to clinical, translation, and even implementation.